Hi, you're looking through this website and you may be at the point now where you're wondering what makes me different from every other doctor that you have seen and why should you come to me for care? Well, the answer is that I assess and treat you metabolically and neurologically. You're on this website because you or someone you love is suffering from a terrible chronic condition. I'm here to tell you that no stone is left unturned to determine the exact cause of your problem. Now, what makes my program unique is the thoroughness of my examination and laboratory workup that is done to gather all possible data regarding your condition. Also, what makes my program unique is how I treat chronic conditions. I treat them by using specific metabolic and neurologic treatment protocols. But first, before we commence treatment, we run in-depth tests to assess the cause of your chronic condition. We do sensitivity testing to determine if you have a sensitivity to gluten, milk, eggs, yeast, or soy. If you are sensitive to any of these food groups, it could be making you sick. Here are some of the symptoms of these sensitivities: feeling bloated after eating, frequent loose bowel movements, constipation, mouth ulcers or sores, vomiting often, chronic pain or fatigue, and frequent indigestion. The only way to find out if you are suffering from any of these sensitivities is to run the test. We also run complete blood panels by using specific blood tests such as a complete metabolic panel, CMP, a lipid panel, a CBC or complete blood chemistry with autodifferential, and a thyroid panel. We can assess your thyroid gland, adrenal glands, liver, kidneys, red and white blood cells, and gut function with the above lab test. All of these organs and your blood can be affected with chronic health conditions. The CMP also allows us to check your blood glucose levels, since glucose is needed by the brain to function properly. We run an adrenal stress index test. We can test the adrenal glands with a test called an adrenal stress index test. This is a salivary test, much like DNA testing. The adrenal glands sit right here above the kidneys in the back, and they are your stress organs, meaning that they react to stress. If you are under stress, then this test is a must. If you suffer from insomnia and or diabetes, this test is a must. It will measure your cortisol levels. We check immune panels, which are extremely important. You could be suffering from an autoimmune condition. That means your chronic condition could be caused by an autoimmune condition. Your immune system could be attacking your nervous system or other systems of your body, and this is why these immune panels are so important. Now, there are two parts to the immune system, Th1 and Th2, and they must be in balance to be healthy. We also want to determine if there is an active antigen or an immune system dysregulation problem. Active antigens are parasites, bacteria, virus, mold, yeast, fungi, protozoans, food, chemicals, and heavy metals, and we want to see if you are infested with any of these. We check intestinal permeability. This test is used to determine if you suffer from leaky gut, LGS, which stands for leaky gut syndrome. Leaky gut syndrome describes a condition of altered or damaged bowel lining caused by antibiotics, toxins, poor diet, parasites, or infection, which can lead to increased permeability of the gut wall to toxins, microbes, undigested food particles, waste, or larger than normal molecules. Now, it has been proposed by some that these substances affect the body directly, while others think that an immune reaction to these substances occurs. We also check hormone panels. We can check hormone panels to determine if the patient suffers from low testosterone in males or low estrogen, progesterone levels in females. Now, symptoms related to decreased hormone levels may include depression, fatigue, mental fogginess, mood swings, hot flashes, sweating attacks, weight gain, and decreased physical stamina. After getting the test results, we analyze the results and then formulate treating diagnoses. We then utilize specific neurologic and metabolic treatments to get you better faster. We may utilize any of the following: brain-based therapy, or BBT for short. We use specific brain-based therapies such as the following: vibration therapy. Vibration fires a part of the brain in the back known as the cerebellum, and one of the functions of the cerebellum is control of spinal muscles. We also do sensory stimulation, which could be in the form of auditory, visual, olfactory, and caloric stimulation. We do this to increase firing of the brain. Another way to effectively stimulate the brain is through upper body exercise. In addition, we may use specific neuro-rehabilitative exercises to improve brain function. It is this BBT that we can use to work on your brain, which may be the seat of the cause of all or part of your problem. By using BBT, we are able to stimulate the underfiring areas of your brain to increase their firing, which will then slow down overfiring areas of your brain. Brain-based therapy is also called brain-building technology because of a phenomenon called neuroplasticity. Until recently, it was thought that older brains were set and could not change in structure. I'm sure you have heard the old saying, you can't teach an old dog new tricks. However, recent research has revealed that a brain at any age can change its structure, and that is called neuroplasticity. Neuroplasticity simply means that a brain can improve on and even form new connections between neurons when it is stimulated, and this is what we do with BBT. With new or improved connection, the brain functions better. We may utilize physical therapy if warranted, such as ultrasound, electrical muscle stimulation, or intersegmental traction. We may also recommend lifestyle changes as part of our tender loving care. Some lifestyle changes may be in the form of dietary changes or exercise program. We may also utilize glutathione in our treatment of your chronic condition. Glutathione is the mother lode of antioxidants. Glutathione cannot be taken orally in pill form, so we will use either a nebulizer or a cream. The reason why it cannot be taken in pill form is the body will not absorb it. We have seen miraculous changes in our patient population as a result of our specific glutathione protocols. Further, we may use nutrition. We use natural nutritional supplements to help get you better faster. Your supplements are based on the results of your lab work. We treat you based on your specific needs. In addition, for certain conditions, we may use a rebuilder, which is a specialized electronic device to stimulate affected nerves. Excuse me. Once we have run the necessary tests to determine your specific condition, we will treat you via proper neurological and all natural nutritional protocols. Everything we do is with you in mind. Our goal is to help you get well as quickly as possible. Remember, why not treat yourself to good health today? You deserve it. Thank you.